Okay. Okay. I'll speaking of modified approach for public education in diabetic retinopathy. As we know, successful program to combat diabetic retinopathy in part relies upon the level of awareness about diabetes within the community. It appears that awareness of diabetes and diabetic retinopathy is relatively low in many parts of India, making it difficult to engage in preventive actions, diagnosis, and treatment. Awareness that diabetes can cause diabetic retinopathy is present in only 28.8% of the urban population in a study done in the southern India. I am present of a study in which all screening cum treatment camps were organized between November 2009 to December 2012, in which all the patients were included. All the camps were organized in the Bagpat district of the Uttar Pradesh. On the day of the camp, a mobile van equipped with the portable angiography and the laser machines was taken to the pre-decided area, in which all the diabetic patients were screened. In that examination was done, and though all patients found to be suffering from diabetic retinopathy, their angiography and laser treatment was done there and there itself. As we know, there are three main approaches for the public education in diabetic retinopathy. These are mass approach, which comprises of public meetings through posters, TV and radio programs, and in ads in the newspaper. Group approach through seminars and lectures, patient interactions, and group discussions. And individual approach through patient education through leaflets and individual counseling sessions. We tried all this approach by organizing press conferences, seminars, and lectures, giving articles in the newspaper, organizing patient interaction camp sessions at the campsite, and also organizing special days like World Diabetes Days. But we found that all these approaches were more useful in urban and semi-urban areas, but were less useful in rural areas. People vary so widely in their socio-economic conditions, tradition, beliefs, level of knowledge, and mixture of different approaches are required. There is lack of awareness about diabetes, and it is also lack that diabetes can affect vision. As we were doing all these approaches, we find that all these were not getting the desired result. So we developed an educational movie to impart about diabetic retinopathy, impart knowledge about diabetic retinopathy, covering all the aspects of diabetes. This was a 45 minutes movie in which a protagonist was shown who was a diabetic, and all the procedures like laser procedure, angiography, surgical procedure were explained in great detail. This movie was shown in the rural areas through cable networks and through various aspects, and we found that after this approach, there was significant increase in the patients who were coming for the diabetic retinopathy camps. There was 50% increase in the patients of opting for the laser treatment, and thus I would like to say that diabetic retinopathy is a major cause of blindness with public health implications in India. Prevalence of diabetic retinopathy in South India over 50 years age are found to 1.3% in one study, and is going to increase exponentially in the coming decades. In a study done in Chakman Panchayat of the Ernakulam district in Kerala, it was found that literacy, these factors highlight the need for population diabetic retinopathy awareness and prevalence in diabetic studies. In conclusion, I would like to say people vary so widely in their socio-economic conditions, tradition, beliefs, and attitudes, and the level of knowledge that uniform communication approach is not viable. A mixture of different approaches must be developed depending on the local circumstances, and we have to constantly evolve new methods of screening and awareness. Thank you.
Excuse me, doctor. What was the aim of your study?
My aim was that we organized camp just to identify the patient of diabetic retinopathy and to treat them.
But here,
in this study, the aim of this study was to see the which new approach of diabetic retinopathy. We made a movie of educational movie. So we found that after showing that movie, the patients who were opting for the laser treatment have increased. Patient opting for treatment have increased. The awareness have increased.
That is for the treatment. Yes, what about the awareness?
Because as far as because the awareness increased, there only the patients came for the camps, and the number of patients who approached the camps were increased after the movie. That was the.
So the modification was you prepared a educational movie.
Actually, because of possible time, could not show the clips of the movie. And this was not allowed. But it was a 45 minutes movie, and it was a documentary, not a documentary, it's a docudrama in which a protagonist was shown. And from beginning, the patient was diagnosed with diabetes, but he did not opt for the treatment, and eventually he lost vision in the one eye. Then he started creating awareness in the local public. So that was like a drama kind of movie in a local language. So
was a particular area was captured for that?
My Bagpat district of the Uttar Pradesh.
Okay.
in that area only.
Thank you.